You are live on Omega Live TV, and I want you to tell me your name and what you do, just briefly.
Right, thank you, Winnie. My name is Douglas Twenefour. I'm a dietitian. I've been practicing in the UK for over 14 years. Recently, I've been working with Diabetes UK as a deputy head of care, and my role is to put together guidelines for other healthcare professionals to use.
For other healthcare professionals to use. And you contacted me to say, Winnie, I want to come on your show. And honestly, I was very, very thrilled by that, because it means we share the same vision of trying to get health knowledge out there to our people. So I think we are doing the right thing. We will go straight into the topic for tonight, putting diabetes into remission. But diabetes, I guess, is a very well-known topic. But we cannot actually discuss how you can get someone into remission without going back to look at what diabetes is. So what is diabetes? Great
question. So diabetes is a group of conditions. So diabetes is not one condition, group of conditions where your blood sugar levels, so the sugar in the blood, is high. And it's usually high because the body cannot use it properly. And the reason why the body cannot use it properly is that the body needs what we call insulin to be able to use sugar in the body properly. So if for one reason or the other, the body is not producing any insulin at all, which is in type 1, then your sugar levels will be high. But in type 2, where the body might be producing some amount of insulin, but it's not enough, or the insulin is not working properly, then you still have sugar, a lot of sugar in the blood. And it's a concern when there is too much sugar in the blood, because if that continues, it affects your blood vessels, and in the end, it can cause a lot of problems.
Yeah, I mean, obviously, during COVID, we have heard a lot about comorbidities, and diabetes has always been highlighted as one of the risk factors. So I think we are doing the right thing to be looking into how, especially, we can do something positive about our diabetes. That is, if we do have diabetes, how can diabetes be diagnosed then?
So usually for type 1, most people will have obvious symptoms, and we'll talk about the symptoms in a few minutes. So they will go to their GP. The GP will have a blood test. Sometimes the GP will have what we call the finger prick test. That will be a quick one to tell the GP if the blood sugar level is very, very high. But a finger prick test is just an indication. It's not conclusive diagnosis of diabetes. So they will take a blood from your arm, and then they'll take it to the lab, and they will analyze it. If you turn up to your GP when you have eaten, then that will be a random blood test. And usually they are looking at something below 11.1. If it is higher than 11.1,
for the blood glucose level.
Yes, for the blood glucose level. Then they will say that you have diabetes. Normally, if you have obvious symptoms, as in the case of type 1, then you need only one blood test. But if you have no symptoms at all, so for example, you are doing a random blood test, and if they find out that your blood sugar levels are high, maybe random blood sugar, as I said, 11.1 or over, or a fasting blood glucose level which is over 7, your GP will repeat it if you don't have any symptom at all. So usually the test is from a blood result that is taken from the arm. If you have symptoms, no repeat. If you have no symptoms, then your GP will repeat it, and they will tell you your results. And normally, then that will start the journey of getting you the treatment to be able to manage your condition properly.
Right. So you kept mentioning about symptoms for those who are type 1s. So I guess for type 2s, they may probably not even have any symptoms.
Yes.
Is that the case?
That is the case, and that's a worry. So for people with type 1, the obvious symptoms may be that you go to the loo more, so you urinate more often than not. which then means that you drink more water more than often, and then you feel tired. Some people lose weight without trying to lose weight. And then some people may have cuts and bruises that may take longer to heal, mainly because the nutrient that is supposed to be transported to the site of the wound is not being transported properly because of the high blood glucose level. So wounds will take longer to heal. So for type 1, these will be the obvious symptoms. And for type 1, the symptoms can develop in a matter of days or weeks. But unfortunately for type 2, the symptoms are more subtle. So some people with type 2 can live for about 10 years with a condition without being diagnosed, which is a worry for us. It's a worry because what happens is that people with type 2 can turn up with long-term conditions of diabetes before they get diagnosed.
Right, which is obviously a worry if you don't know and you're walking about. I mean, I do know that is true because a lot of people have, they find it accidentally, isn't it? Going to the hospital for one reason and then being told that they have type 1 or type 2 diabetes. So are there any risk factors then that predisposes one to having diabetes?
So for type 1, the only risk factor we know is that it runs in families. So genetics is the main risk factor for type 1. For type 2, again, family history plays a part. Ethnicity plays a part. So we know that people from our part of the world, so people from Black African communities and Black Caribbean communities, we are more likely to have it more than people from white background.
Is there any reason why?
It's a multitude of reasons. One of which is that unfortunately the way we store fat, which is the way our body is genetically programmed to store fat, is different from the way people from white backgrounds store fat. So if you take somebody from a Black community and, for example, they weigh, say, 100 kilograms, and you take somebody from a white background and they weigh the same amount of weight, if you check how much of the weight is made up of fat, the person from Black background will have more fat as a percentage of their own weight.
Really?
Yes. But also, we tend to store the fat around our organs more so than people from white background, which makes a huge difference. But to go back to the risk factors, so we've talked about family history, ethnicity, age is a huge factor. So for example, we know that in the UK, the general population risk of type 2 diabetes increases after the age of 40.
Right.
Unfortunately, people from Black African backgrounds and people from South Asian backgrounds, the risk increases after the age of 25, which means that our risk increases at a younger age. We are at a higher risk of developing the condition, but the awareness is not as great as it's supposed to be.
No, because we wouldn't expect people as young as that, 25, we wouldn't suspect that, isn't it, in the relatively younger ages?
No, but unfortunately we are picking up a lot of people at a younger age who have developed type 2 diabetes, because one of the key, I've mentioned about 4 risk factors, but the key risk factor is having obesity. So if your weight is up, especially if the weight is stored around the middle, then your risk of developing the condition is significantly increased.
What about those who get diagnosed with diabetes in pregnancy, gestational diabetes?
Yes, so gestational diabetes is a condition where blood sugar levels during pregnancy increases. It doesn't increase as high as normal somebody with a type 1 or type 2, but that small marginal increase, we know, has an effect on birth outcomes. Thankfully, gestational diabetes is only limited to pregnancy. So after delivery, it goes away.
It goes
But
away.
yes,
Right.
but unfortunately, when you have gestational diabetes, your risk of developing type 2 diabetes is significantly increased. Why? Because the risk factors for gestational diabetes, which includes family history of diabetes, ethnicity, old age, and obesity, are similar to the risk factors of type 2 diabetes.
Type 2 diabetes, I see. Right. So, I mean, obviously, we've mentioned type 1, type 2 again, and I know eventually tonight we're going to be focused on type 2 diabetes. But can we look at the two types again?
Okay.
Type 1, you said it can be run in families.
Yes.
Right. And then what else do we really need to know about that? I guess that will be diagnosed earlier on in life.
Yes.
Right.
So usually type 1 tends to be more prevalent in children. The median age of diagnosis is around 13. But we do have older people who get type 1 diabetes. Our own former Prime Minister, Theresa May, was diagnosed in her when she was actually a prime minister. Right. So people can develop it at an older age, but mainly younger people tend to develop it. Whereas type 2 tends to be with older people.
I see.
In terms of the differences, the key difference is what causes the diabetes, or what is the genesis or the etiology of the condition, which is that for type 1, you are not producing any insulin at all.
Right. Okay.
Which means that at diagnosis, straight away you have to go on insulin, because we need insulin to survive. Insulin is the only thing that can help us use sugar to produce energy. For type 2, because you're producing some amount of insulin, but your insulin is not enough or it's not working properly, when you are diagnosed, you can be told to maybe make some lifestyle changes, which includes losing weight, includes eating well, and doing some amount of exercise. But eventually, many people have to have medications, which may include insulin.
Okay.
But let me stress that when you have type 2 and you are on insulin, it doesn't make your type 2 type 1.
Okay.
So the treatment of the condition does not change the type of diabetes you have. So if you have type 2 and you go on insulin, you still have type 2, which is being treated differently.
Right. I mean, that makes more sense to me now, because obviously we as healthcare professionals do want to know the history or the medical history of people, and then we tend to see a lot of type 2 diabetes on insulin as part of the history. So it's the first time I'm having a clearer understanding of why we term it that way and not classify them as a type 1 but a type 2 on insulin. So that's a very good learning curve for me. So what would happen if we leave our type 2 diabetes untreated, or what are some of the complications? Let me put it generally. What happens if diabetes is left untreated? And then we can start to look at how we can
treat it.
Yes.
So I mentioned that blood sugar levels, when they are too high for long, if they are kept high for long, what happens is that they affect the blood vessels. So they affect the bigger blood vessels, such as the blood vessels that supplies blood to the heart. Blood vessels that supply blood to things like your kidneys, they are all affected. So the main complications, the biggest complication is heart attack.
Right.
Because when the blood vessels are affected by high blood glucose levels, they become weaker. They become not as smooth as they're supposed to do, which means that the way blood flows through the blood vessels is affected. And if that is kept ongoing, it can clog the blood, which means that if it clogs the blood vessels supplying blood to your brain, then you can have a stroke. If it affects the blood vessels that supplies blood to your heart, then you can have a heart attack. Diabetes, if it is not treated again, can also affect your kidneys, because there are tiny blood vessels that supply blood to the kidneys. And if that is affected, the way your kidneys filter the blood can be affected, and which is why some people end up on dialysis for their diabetes. So, for example, if you go to a dialysis department, most of the people there will have diabetes. The other thing is that because blood vessels that supplies blood to your limbs, so your extremities, so things like your foot are affected, when you have a cut, as I mentioned, it takes a little bit longer to heal. And some people may not even realize that they have a cut. So unfortunately, people end up getting amputations because small wounds end up being ulcers, end up not being treated, get infected, and in the end, the only way that we can save your foot is to have an amputation. So amputations is one of it, and I'm sure when you spoke to Sam, he also mentioned the issue of blindness as a result of retinopathy.
I mean, there was one point you made about patients getting heart attacks, and obviously you know that for obvious reasons, I am particularly interested in the heart patient, and it is the histories that they tell you, they don't particularly have chest pain, when they are diabetics. And so it's worth knowing that we have to obviously watch out for other signs and symptoms rather than chest pain. And I see that practically all the time. So it's good to know.
Part of the reason why they don't have chest pains is that the blood sugar levels, when are high, affect your nerves. And you need your nerves to be able to feel pain. So that's the reason.
That is the reason why. So if you are watching, or if your family is watching their diabetics, then your risk of heart disease is even higher, especially when you have a heart attack, because then you may not perceive the pain, and so you may not report in time. So obviously we have to watch out for other signs of heart attack in the diabetic patient. Right. So now we are going to focus on remission.
Okay.
And you sent me a lot of very interesting materials to read. For our viewers, I'll say that I'll be sharing the links, as many people as want to read, because I did see or come across a lot of patient accounts of how they have gone through. And then also reading all the material, there was a study which actually throws a lot of light on this. The direct, is it direct?
The direct study.
Yeah. So if we say diabetes remission, what are we talking about? What is it?
So it is similar to say cancer, where it means that the condition, you still have the condition, but the main outlook of the condition has been reversed. So in the case of diabetes, and we are talking about type 2 diabetes as you mentioned, it means that your sugar levels are behaving as somebody who does not have diabetes when you are not taking any diabetes medication. And that is achieved through significant weight loss. And as you mentioned in the direct study, this is a study where people were put on a liquid diet. So
it has to be a liquid diet.
We'll come to that. So for the direct study, they used the liquid diet, but there are other options, and I'll talk through those options. For the direct study, they put people on liquid diet, which means that they were eating about 850 calories a day. That is about your normal, less than your normal one plate of jollof rice. So they were eating that for a day, for the whole day. So they were having shakes of milk, one in the morning, one in the afternoon, one in the evening. And they did that for about 3 to 5 months. What happened was that they lost a significant amount of weight. So for those who lost about 15 kilograms, 90% of them put their diabetes into remission. Those who lost about 10 kilograms, 70% of them put their diabetes into remission. What they did was that after the 3 to 5 months of the liquid diet, they then coached them to reintroduce normal foods. But because they had been on this strict diet for a longer time, when they transformed them to the normal foods, they were not able to eat huge amounts of food. And these are people who had significant amount of weight to lose.
Right.
So the idea is that their appetite levels had dropped, the size of their stomach had reduced, which means that they tolerated less amount of food. And for these people have been able to live for 2 years, some of them 2 years, without diabetes, without having diabetes medications, and their blood sugar levels are behaving as though they don't have diabetes.
Really? You will obviously have to expand on this, because this topic is of particular interest to so many people who want to lose weight.
Yeah.
Because like me, I've been trying all sorts, and we are not, and sometimes we want to wait till we have a diagnosis before we start doing something about our weight. For instance, and you know that especially for Africans and African women, carrying a lot of weight is like attractive, or it used to be, isn't it? That is the mentality.
Yeah.
And it's a sign of wealth and looking good and all that kind of thing. So having to lose so much weight is obviously going to be a concern to most of us. For the normal person who just wants to lose weight, do they always have to go on this liquidized diet?
You don't have to go on the liquidized diet, because subsequent to direct, there are a few other publications that have shown that you can actually use your normal foods, reduce how much you're eating, try to do some more exercise, and you'll be able to lose the weight. There is another specific diet that is showing to be very, very effective, which is a low carb diet. So instead of eating a big bowl of fufu, you probably reduce the amount of the ball of fufu you are eating. Maybe then have more of the fish, have more of the contomere to beef up your soup. So you have more of the soup and then less of the fufu. That is also showing to be very effective in putting people into remission. But I have to underscore that the only way that people are able to put their diabetes into remission, as we know now, is through weight loss. And without weight loss, it is almost impossible to put your diabetes into remission. Which then means that for people who have diabetes but their weight is normal. What do we do with them? Thankfully, there's an ongoing research to see whether people of normal weight can still put their diabetes into remission. The idea behind that is, even though we see people as normal weight, everybody has a personal fat threshold. So for some people who may be seen as not being too heavy, they still have some small amount of weight to lose, which will affect the way their pancreas work, the way their liver works, which will then help them to put their diabetes into remission. So it means
you don't need to be always fat to be diabetic
or
type 2 diabetic. You can still be slim and still end up.
So we know that for type 2 diabetes, about 90% of the people who have it will have obesity, or their weight will be high. But there is a significant 10% whose weight can be classified as normal weight. But the idea is that even though their weight is classified as normal weight, they carry a small amount of fat around their liver, around their pancreas, which then tips them over to push their risk of getting diabetes.
Right. So by normal weight, are we using the body mass index chart to classify people, like to healthy weight, and then is that what we use? Generally?
So generally we're using, that is the one that is used in clinics, which is that we weigh you, and then we weigh you in kilograms, and then we take your height in meters, and then we are able to cost what your body mass index is. Normally, if it is above 30, then we say you have obesity. If it is about 25, then we say your weight is classified as overweight.
Yeah, I know for a lot of people, getting to shift any weight at all is such a big deal, isn't it? It's a problem, and we struggle to do all things, exercising and all that, and it still isn't effective enough. But reading the materials again that you sent, we were talking about just about 5. Is it 5%?
Yes, 5%.
Yeah, and I said, okay, so that means that for somebody who is 100 kilos, all they have to come down to is about 95 kilos.
Yes. Yeah.
And that will achieve some results. Yes. I mean, on paper, that's not bad at all.
So the idea is that you can decide that my weight is up. I want to get down to so-called normal weight.
Right.
That is a good target to aim for, but for many people, it's unrealistic. Right. What is realistic is you ask yourself, how much weight do I need to lose in order to accrue health benefits? And throughout research, we know that if you are able to lose about 5% of your weight, you are able to accrue huge amount of health benefits, including if you have diabetes, your sugar levels will come down. If you are using medications to treat your diabetes, many people will reduce their medications. Your blood pressure will come down, your cholesterol will come down, but also for your own mental well-being, people feel better when you're able to lose that amount of weight.
Yeah. Doing this program, I've come across, sometimes it comes across as if we are giving so much information, but I think it's important we set it real, so people really know what they can do realistically. When we mentioned about like having your blood sugar done with the GP and then kind of having a blood result of like 11 millimoles on the blood sugar test, but the lab one, I think we missed talking about the lab one, isn't it?
HbA1c?
Yeah. So what normal level do we need for that?
The HbA1c, the way it is presented has changed recently. Okay. So in the past, up to I think 2011 or so, we used to have it as a percentage of your hemoglobin. So HbA1c is usually, it's telling you how much of your red blood cells have sugar attached to it. So what it does is, normally as we are sitting here, if I check my sugar levels and maybe walked to the street and came back, my sugar levels will change. But HbA1c is a way of checking the average of your sugar levels over the past 2 to 3 months. Okay. And it can be either costed or indicated as a percentage. If you are using the percentage, then you want it to be below 6.5, because it is 6.5 that is diagnostic of type 2 diabetes. So if it is above 6.5, it means that you have type 2 diabetes. And the reason why they use 6.5 is that when they did a large study, they saw that the complications of diabetes, especially the eye problems, seem to be significantly higher when your sugar levels or your HbA1c is above 6.5. Right. So they decided that 6.5 should be the diagnostic criteria for type 2 diabetes. As I mentioned, nowadays it is depending on the way the lab will show it to you. Sometimes they will show it as 48. Right. 48 is the same. It will be 48 millimoles per mole is the same as 6.5. Okay. So for people with diabetes who are trying to manage their condition properly, you want your HbA1c to be below 6.5 or below 48. And that is also the same criteria that we use to say somebody is in remission.
Oh, I see. Right, that's really good to know. For those of you who are watching, I think it has been very interesting so far, and we'll be diving deep into remission and how we can achieve that as individuals. If you want to phone in to the studio to ask Douglas a question, you can phone in. It's a UK landline, and it's 0751 368 8333. 0751 368 8333. And that's the line you can call to ask Douglas a question. So far, we have been looking at diabetes, the types, the risk factors, and obviously looking at how we can get type 2 diabetes into remission. And so far we've been looking at, is it diet?
Yes.
Yeah, a liquidized diet.
Yes.
I mean, for most adults, we do not live on a liquidized diet, but we do want to lose weight.
Yes.
So can we look at like proper meals?
Okay.
And how we can use that to still achieve the same kind of results?
Yeah. So the liquidized diet is very difficult to follow. Most of the people who were in that particular study, they had healthcare professionals more or less on tap, i.e., things are going wrong, then they can phone their healthcare professional. So just to put it out there, if anybody is trying to use that, I will recommend that they involve their healthcare professional, because it is difficult to do it on your own, and in some people it might be even unsafe to do it on your own. The other extreme way that people can also achieve, before I come to the our usual foods, the other extreme way that we know people can also achieve remission is through bariatric surgery. So again, when your GP has seen that maybe you've tried losing weight in some ways and it's not helping, they can refer you to a bariatric surgery where part of your stomach is an intensive surgery, where part of your stomach could be cut off, or your stomach can have a band, all aimed at aimed at making sure that you have a smaller stomach, so that when you eat small amount of food and you get fuller, which means that in the long term you'll be able to lose weight. So these are things that you can do, or you can go to your GP and discuss about if you want to go down that line. But as you mentioned, there are people who have also lost weight, significant amount of weight, through eating our usual foods. And for me, as a dietitian, normally I'll say that when you want to lose weight, you don't have to change your African foods. You don't. Most of our African foods are actually very healthy, and I'll tell you why. If you go back home, and let's not even talk about home as in Accra. Let's go back to maybe our villages. Most of the food they eat are from the farm straight to the fire. For us here, most of the foods are from the farm to the food manufacturer's plant before it comes to us. So most of the foods we eat here are very much processed foods. They are not as healthy as our normal, minimally processed foods like our plantain, our yam. They are all good. The problem we have is the quantity we eat.
Yeah, definitely.
I always tell people, think about it. Why do we have balls of kenke in that size, but people will want to eat 3? Why do we have a size like this and you don't want to try eating one of it and see whether that will satisfy you? But because we have been programmed to get full now. I want to get full now. Meanwhile, that's not the last food you're eating. If your thinking is that I'm eating just enough of this food, it's not my last meal, there will be another meal coming, then you can begin to more or less reprogram yourself. Because I will tell you, losing weight, the significant things that you need to do are getting support first, but also getting that mental battle.
So getting support from...
So support comes in different ways. I would say the first support perhaps you need is having maybe a dietitian or a nurse or a nutritionist to be able to go through some of the key principles of losing weight. But also you need support from your friends and family. And I'll tell you why. Sometimes they could be your downfall. I once had a gentleman in my clinic who I was going through his diet, and he told me I have about, when I counted, it was about 12 cups of tea a day. And I asked him, how much sugar do you put in your tea? Then he turned around to ask the wife. He had no idea how much sugar the wife put in it. 3 teaspoons of sugar. So 3 teaspoons of sugar times 12, you're talking about 36 teaspoons of sugar.
In a day.
So the idea is that get your family on board, because healthy eating is good for everybody. It's good for the children, it's good for our spouses. Discuss it. Let them know the reason why you want to lose weight. And tell them the kind of support you want. The kind of support might be that I know you like your Friday night doner kebab. Please, when you want to have it, tell me so that I leave home, so that I don't get tempted. Those are practical conversations you can have. When you are in the office, you can tell your colleagues, when you make your tea and you have your biscuit, please don't give me one of your biscuits. Keep it to yourself. Those are practical conversations, but we are not comfortable to have those practical conversations because sometimes we think that we'll be hurting people. So winning the mental battle, getting support, and planning. Planning in my book means that the way people go to war, and to a large extent, losing weight is like war, because as you mentioned, it's very difficult. Planning means even before you go to buying food, especially in this country, when you go, and I'll tell you this, next time you go to the supermarket, look at the kind of foods that will be at your eye level. Those are the tempting ones. The supermarkets are clever in tempting you with on very processed foods. So you have to know what you're going to buy. So I always tell people, write down what you're going to buy. The other thing is that before you go shopping, eat before you go shopping for food. Why? Because if you're hungry and you are at the supermarket, your decisions will be manipulated by the hunger. So you buy stuff that perhaps you usually will not want it, but because they are tempting, and they are tempting because you're hungry. So planning is important.
Yeah. Well, I mean, that is practical enough, isn't it? Yeah. Does it mean when you've done all that, I think we will come and look at a specific, like a diet, or look at a meal for an African person, for instance, in a day.
Yes.
Yeah. But can we do all this, and does it mean it will be treated? Is it going to treat our diabetes, the type 2?
So if you have type 2 and your weight is up, any help that you can get to lose weight is your best bet, because we know that when you lose the weight, and as you mentioned, 5% is enough. But if you want to lose weight in the process of achieving remission, then you will need more weight loss, which is about 10 kilograms or sometimes even 15 kilograms to increase your chances of getting diabetes into remission. What you need to do is, first of all, as I mentioned, get support. But you also want to say that, okay, this is a condition that I normally treat with my medications. Do I need these medications for the rest of my life? Because our understanding of diabetes is that it's a long-term condition. You live with it for a long time, until now that we know that you can put it into remission. So your motivation will be that I want to lose weight because I want to come off my medication, or better still, I want to reduce the amount of medications that I am on. I want to lose weight because I want to put my diabetes into remission. I want to lose weight because I will feel better as well. So these are some of the motivations that can help you to sometimes persist when your weight loss plan is not going according to how you had planned it, because weight loss is not a smooth journey. It's unlikely that you will start losing weight, maybe 2 kilograms, and every week you will be losing 2. Sometimes you will see that you lose the weight, it comes down, you lose your weight. That is normal. What you want is that at the end of the day, maybe within the next 3 months or 6 months, I want to lose 5 kilograms.
Yeah.
And when you have such a target and you get the support, you have the planning around that, and you are able to get the support from your family, then that can be helpful.
It can be helpful, right? So it is not. It can be permanent, or it's not.
So at the moment, what we know is that there are people who have been able to put their diabetes into remission for over 15 years.
Oh, okay.
So because remission is a new way of looking at diabetes, we don't have long-term data to say that it is permanent. So at the moment, we are cautious to say that it's not permanent. And there's a key reason for that. One, because we don't know that if you are in remission, whether it reverses all the quote-unquote damage that the previous high blood glucose levels have done.
Yeah.
So, for example, if you are in remission, doesn't mean that you will never have diabetes complication. We don't know that. So it is better for people to be aware that it's not permanent. Because if we told people that it's permanent, it means that they will not go for their usual diabetes checks. But it's only when you go for your diabetes checks that we will know if the diabetes has come back or if your blood sugar levels have come up again. It is also only when you go for your checks that we will know if you have any undiagnosed complication of diabetes. So it is more of a cautious language to say it is in remission, and remission is not permanent.
Right. I mean, for people who have other conditions like cancer, before they get told that they are in remission, they would have done scans and all sorts of tests to confirm that indeed you are in remission, and then to follow them up over time to be sure that, say, over 6 months, something is not sort of growing again or whatever. Is that the case with type 2 diabetes in remission as well?
That's a great question, actually. So for type 2 diabetes, in the general population, the key indicator is your HbA1c. Okay. So if your HbA1c is below 6.5 and you maintain that, in the UK now we're saying that you maintain it for about 6 months, then we can say you are in remission without medication. But I've been working with some colleagues from the American Diabetes Association, and we have developed an international definition which will be published in the next few months. And in that definition, we have actually reduced the length of time that you need to monitor the person for. So if you are able to manage your sugar levels, HbA1c below 6.5 for 3 months without the use of medication, the new definition will say that you are in remission.
And what was it before?
It was about 6 months.
Right.
Even before that, the American Diabetes Association had it for a year. So you maintain it for a year before we say you are in remission. But the group that I belong to, we balanced the research with practical pragmatism, which is that it is more motivating to tell somebody that maintain your sugar levels for 3 months, come back 3 months. If I check it again and it is still low, then we can say you are in remission. It is more motivating than telling the person to come back in a year's time.
Yeah.
Within that long term, it is possible that they may lose the motivation and they may relapse. But to come back to your question of, are there any particular scans that can also detect that somebody is in remission? Crucially, in the direct study, when people have gone into remission, what they did was to do an MRI of their liver to check the amount of fat in the liver. So usually for people without any metabolic condition, you want your liver fat not to be more than 5% to 10%. When they checked people with type 2 diabetes who had obesity, their liver fat was about 36%. Okay? And then these people, after they lost the 15 kilograms and their diabetes was in remission, guess what? Their liver fat dropped to 2%. So that would be indicative that your pancreas will be working properly because the amount of fat around your organs have been stripped off. That is an indication that yes, if you are able to maintain this, your risk of things like high blood pressure, your risk of things like high cholesterol will also be significantly reduced.
Right. So then can we say that we've been treated of the diabetes?
Yes. So all people who have achieved remission, first of all, their diabetes is very well controlled. And even those who at some point may need some medications back, their diabetes, the trajectory of their diabetes is such that it is not as difficult to treat as people who have not achieved remission at all. So remission, even if you don't achieve it, you get a lot of benefits if you're able to lose the weight.
Right. I mean, that's good for everyone watching this. But the question I asked earlier on, looking at our diet, typically an African diet, or let's familiarize ourselves with what we tend to eat in Ghana, for instance. What should our daily intake sort of be? Because like you said, you rightly said, we've been trained to eat like bowls of everything. You know, it has to be big, for us to be having a meal. How much should we start training ourselves to eat, say for breakfast, for lunch? And I think culturally, people are used to having that quantity, because a lot of the time they say they are eating is the only meal I'm eating in a day, and I only eat like a heavy breakfast, and then I don't eat anything. And what is the right thing to do? So
I struggle to tell people what is the right number of meals to eat in a day, and the reason for that is that the evidence is not clear cut, but we know that eating breakfast in particular seems to be very beneficial. So, and breakfast in our
contest,
our contest could be jollof rice, or it could be leftover kenke, it could be yam. I don't think it makes a huge difference. The only thing that I would say is that because things like dairy is not part of our diet, it is, especially if you are here in the UK, it's better to have cereal in the morning. And the reason why I said that is it's an opportunity to have dairy in your diet. We know that dairy as in milk or even yogurt, and it's not the sugary yogurt that we have, the natural yogurt. They are good in reducing your risk of type 2 diabetes. So having, say, maybe 2 tablets of Weetabix, that could, and I'm talking of here, if you're here, with some milk. Maybe if you like, put some berries in, an opportunity to get your 5 a day. That would be a good breakfast for me. If you want a couple of slices of bread, I would say the seeded bread is better, mainly because it is low glycemic index and it gives you more fiber as well. So a couple should be okay. More than that, you're probably doing it too much. And then if you want a spread on it, I'll say not butter. The spreadables are better, i.e. the vegetable spreads. They are better because they are less in saturated fat, which can affect your cholesterol. So again, if you spread it thinly, then that will be a good breakfast to have. Usually for men, and this is very, very general, we are looking at about 2,000 to 2,500 calories per day. The breakfast I just mentioned, you are looking about maybe 500 calories for breakfast. Yes, and I think and then for ladies, you're looking at maybe 1,500 to 2,000 calories a day. So if you're having 500 in the morning, maybe 600 in the afternoon, and maybe another 600 in the evening, you're around 1,007, aren't you? And you have the opportunity to have some snacks in between if you decide that you're going for a 2,000 calories. But for those who want to lose weight, I'll say for a lady, 1,005 calories, maybe 1,002 to 1,005. And then men, you're looking at not more than 1,008 or 2,000 calories.
Right.
So I've mentioned breakfast, and I've given some options for breakfast. Another good breakfast is oats, mainly because it has a lot of fiber. So you want to have your fiber in, you want to have your dairy in. If you choose not to have dairy, so for example, if you decide that you're having some rice for breakfast, that's also okay. But I would say maybe instead of having a glass of juice in the morning, have a glass of milk in order to get your dairy in. For lunch, many of us who are in the corporate world, who are workers, your sandwich will be okay. But when you're choosing a sandwich, the filling is important. So I would say stay away from the processed meat. So things like bacon, things like ham. Why? Because they increase your risk of type 2 diabetes. They also increase your risk of certain types of cancers and also heart diseases as well. So you want to go for things like tuna will be good, and any fish at all will be good. You can go for chicken as well. Normally the supermarkets do meal deals, but unfortunately most of their complements are not as healthy. So you will have things like a fizzy drink to go with it. You don't want to go there. You will have things like crisp to go with it. If you are not careful, the sandwich itself will be about maybe 400 calories. Their complements alone can double it. So you want to choose sandwich, maybe go for water. When I say this, people say water is so boring. It is boring, but it's good for you. If you don't want water, you can have the fizzy drink, but have the diet version. The diet version is not as good as water, but certainly better than the full sugar version. Yeah. If you are the type who wants to take food to the office, then again your jollof rice will be okay. And what I would say is that your jollof rice, dish out not too much, and not too much, I'm talking about a palm of your hand. Somebody will say, Douglas, you're so mean. What you want to do is that whenever you are eating rice, you want to ask yourself, where am I getting my greens from? Because it is better to accompany your rice with greens every time. So if you are in the house and you're dishing out rice, my advice to many people is that first of all, use a smaller plate. Second, dish out the greens first so that there's not much room to fill up the plate with the rice. And then you can have your protein to add to it. If you go with about the palm of your hand and you have your greens, you're looking about maximum of 700 calories, which will fit in well with 1,008 calories diet or maybe a 1,500 calories diet. Again, if you decide that you want to have some plantain or maybe some yam, choose maybe spinach to go with it. And what you want to do is that you want to have more of the spinach to fill out the plate. So for example, if you had usual medium size yam, if you have 3 slices, you're talking about roughly about 300 calories. If you have 5, you're almost doubling it. So you have to put this into context, because if you have 300 calories from the yam and maybe some 300 calories from your sauce and your protein, 600 calories per meal, that is not too bad. But if you had a whole 700 or 600 calories from the yam alone, and normally the size of our carbohydrates goes with the size of the sauce. If you're having 600 calories of yam, potentially you might be having 600 calories of the sauce as well, and that will double your.
So the bottom line of this is cutting carbs.
You cut down the carbs, especially if you have type 2 diabetes and you cut down on the carbs, it makes a huge difference. And I'm zeroing in on carbs because it is the basis of most of our diet. So you want to reduce it as much as possible. The carbs that you don't want to cut out or cut down will be the whole grain carbs, but also the fruits and vegetables. Those ones you don't want to cut down, because your fruits and vegetables, especially the green leafy vegetables, they have very little calories, and there's good evidence that they reduce your risk of type 2 diabetes.
Right. So everything we've been saying is evidence-based.
That is my role at Diabetes UK, and also I've had the opportunity to recently work with the UK government to come out with guidelines for the UK on how the government will advise people on low carb diet. So it's my specialty.
Right. So what should people do if they want to contact you, or is there anything more that you've been doing privately, like?
So I do some private consultation. I do some on pro bono basis, but because the bills have to be paid, I do some charge minimal amounts. So if people want to contact me, my website is Twenefour Health. 24 being the number 24 health.net. Okay. And I have free information. And I also give people, especially people from our background, free 15 minutes consultations.
Wow. I think that will be useful for anyone who wants to go along this route. And you'll probably see me in your clinic very soon. Viewers, we've been talking to Mr. Douglas Twenefour.
Yes.
Yeah? Douglas, you've been amazing in throwing more light on how we can especially put our diabetes into remission. So we've done an hour.
Wow.
And it's been very, very, full of content. Is there anything you want to say to?
Yeah, I have one I'll say mission, which is that at the moment around the world we have 463 million people with diabetes, right? Around the world, we know that 50% of people who have diabetes are not diagnosed. 50%. In the UK, that number is 17%, which means that the UK is doing well. In Africa, that number is 60%. So awareness within our community is not well. So my plea to people is, if you find out that you are going to the loo more, i.e. waking up in the night to go to the loo 3 times, don't put it down to anything. If you are feeling more tired than usual, don't put it to old age or put it to you are working too much. If you have cuts and bruises that are not healing quickly, if you are feeling thirsty and drinking a lot of water, if you have blurred eye vision, please go and see your GP. It might not be diabetes, but if you get the diagnosis, it helps begin the process to manage your condition properly, because diabetes is affecting a lot of lives, especially back home in Ghana. People are getting amputated, people are getting blindness, people are getting strokes, especially young people are getting strokes. Oh, we didn't know that he had diabetes. It's only when he falls down with a stroke. Yeah. So my plea is that people should take the symptoms seriously. And if you go and you are diagnosed and you are given medications, don't think that medications are evil. They can save your life.
They can save your life. Viewers, like I said earlier, Mr. Douglas Twenefour of Diabetes UK, you are the deputy head at Diabetes UK of Care, isn't it? At Diabetes UK, and he's been throwing a lot of light on how we can put type 2 diabetes into remission. We have talked a whole lot. If you missed it, please go back and watch. And all these health professionals who come here are happy to follow up, with questions. Today, we haven't really gone through your questions, but trust me, I am going to keep linking them up, and they will come up and answer some of the questions, because I do have more questions after the show than during the program. So you are welcome to send me a message on Messenger or through my Facebook. We will be back here at another time. But please, please, please don't forget that there are people that you can always talk to when you are struggling with your help. And that is the whole essence of this show. I am your host. I am Mrs. Winnie Ohinekisi, and this has come to you by kind courtesy of Omega House, Omega Live TV, and we will keep bringing you all these very informative sessions of how you can go through disease. So don't suffer in silence. We are always here as health professionals to help you. Recently, I have been doing a lot of, it's almost like consultation from here with people in Ghana, and it's not a problem at all. Please keep watching Let's Talk About Health, and I will keep linking you up with the right people. Until we come your way very soon with another session, please stay safe. COVID is still around, so please stick to the protocols and make sure you are keeping safe. Until we meet again next time, thank you for watching and stay safe. Thank you. Bye.
Enjoy some fabulous rewards. Get a cool £10 reward when you receive £100 or more from the UK. Tell your friends and family in the UK to send money to your mobile money wallet or bank account using Express Pay and get an extra £10. Terms and conditions apply.